This video is based on a research article published on the UCL London website. Today, we're diving into some exciting new research that could change the way we think about managing blood sugar levels. Imagine if simply shining a red light on your back could help control your glucose. Well, that's exactly what scientists at City, University of London and UCL have discovered. You may ask, why back? It is because our pancreas is located close to the backside of you and me. As the red light penetrates the skin, it is easy to reach the pancreas and help produce more insulin. Let's break it down. These researchers found that exposing people to a specific type of red light, with a wavelength of 670 nanometers, for just 15 minutes can actually reduce blood sugar levels. Now, you might be wondering, how does this work? Well, it all comes down to those tiny powerhouses in our cells called mitochondria. These little guys are responsible for producing energy in our bodies. When exposed to this particular red light, they kick into high gear and start consuming more glucose. The results are pretty impressive. In the study, participants who received the red light treatment saw a 27.7% reduction in their blood glucose levels after consuming glucose. But that's not all. The treatment also reduced the maximum glucose spike by 7.5%. Now, before you get too excited, it's important to note that this study was done on healthy individuals without any known metabolic conditions. But the researchers believe this non-invasive, drug-free technique could potentially help with diabetes control in the future. So, how did they conduct this study? The team recruited 30 healthy volunteers and split them into two groups. One group received the red light treatment, while the other was a sample or placebo group that didn't receive any light exposure. The participants then took an oral glucose tolerance test. This is basically where you drink a sugary solution and then have your blood sugar levels measured over time. The group that received the red light treatment 45 minutes before drinking the glucose solution showed lower peak blood glucose levels and lower overall blood glucose during the 2-hour testing period. Wait, there is more, but do not forget to hit the like button and subscribe, down below. Dr. Michael Poner, the lead author of the study, explains it like this. It is clear that light affects the way mitochondria function, and this impacts our bodies at a cellular and physiological level. Our study has shown that we can use a single 15-minute exposure to red light to reduce blood sugar levels after eating. But here's where things get really interesting. The researchers aren't just excited about the potential for managing blood sugar. They're also concerned about the implications of our modern lighting environment. You see, most of us are surrounded by LED lights these days. But LED lights emit mostly blue light with very little red light. According to Professor Glenn Jeffrey, one of the study's authors, this could be a problem. He explains, sunlight has a balance between red and blue, but we now live in a world where blue light is dominant because although we do not see it, LED lights are dominant in blue and have almost no red in them. This reduces mitochondrial function and ATP production. Hence our internal environments are red-starved. The researchers worry that long-term exposure to blue light without enough red light could potentially contribute to disrupted blood sugar levels and even increase the risk of diabetes over time. Professor Jeffrey points out that before 1990, we all had incandescent lighting, which had a balance of blue and red light similar to sunlight. But with the switch to LED lighting, we might be facing what he calls a potential health span time bomb in our aging population. But don't worry, there's a simple solution. Professor Jeffrey suggests that we can partly correct this imbalance by spending more time in sunlight. Now, you might be wondering, how does this red light treatment compare to other methods of controlling blood sugar? Well, the researchers are excited about its potential because it's non-invasive and doesn't require any drugs. This could make it an attractive option for people who are looking for alternative ways to manage their blood glucose levels. However, the implications of this research go beyond just blood sugar control. The researchers believe that this improvement in energy production within our cells could have wide-reaching effects throughout the body. They even suggest that it might be related to something called the abscopal effect. This phenomenon is observed in cancer treatment, where treating one tumor with radiation can sometimes shrink tumors in other parts of the body. In fact, Previous studies using this same 670 nanometers red light on mice have shown improvements in symptoms of both Parkinson's disease and diabetic retinopathy. This suggests that the benefits of this red light treatment could potentially extend to other health conditions as well. So, what's next for this research? While the results are promising, it's important to remember that this study was conducted on healthy individuals. The next step would be to test this treatment on people with diabetes or other metabolic conditions to see if it has the same effect. If further studies confirm these results, we could be looking at a new, simple way to help manage blood sugar levels. Imagine if one day, managing your blood glucose could be as simple as sitting under a red light for 15 minutes after a meal. But until then, what can we take away from this research? Well, it's a good reminder of the importance of light in our lives. Maybe it's time we all took a page from Professor Jeffrey's book and spent a little more time soaking up some natural sunlight, especially in the early morning. And who knows? Maybe in the future, red light therapy will be as common as taking a vitamin supplement. Until then, we'll be keeping a close eye on this exciting area of research. So, next time you're out in the sun, remember, you're not just getting a tan, you're giving your mitochondria a much-needed dose of red light. And that could be doing more good for your body than you ever realize. Thanks for tuning in to learn about this fascinating new research. Until next time, stay curious and stay healthy.